Hi, Mike Gibson, Robert Mentz, coming to you from ESC 2023, and we are talking about iron replacement in heart failure. Talk to us a little bit about what you found.
Great. So I guess just by way of background, this group knows well that iron deficiency very common in patients with heart failure. A couple prior studies have suggested that giving IV iron may reduce hospitalizations. So in the HEART-FID trial, we looked at 3,000 patients worldwide with HFrEF and iron deficiency. And then we looked at giving IV ferric carboxymaltose, or FCM, every 6 months in order to replete iron stores. And our primary endpoint was a hierarchical composite of looking at 12-month all-cause mortality, followed by heart failure hospitalizations at 12 months. And then finally, in those without those clinical events, we looked at 6 months, 6-minute walk distance. Ultimately, what we found is that each of those components favored ferric carboxymaltose. We saw a numerical reduction in all-cause mortality, fewer heart failure hospitalizations with FCM, and a slight increase in 6-minute walk distance as well. So as we put all of that together, we saw modest treatment benefits, given that this was designed as a special protocol assessment with the FDA. We had a higher bar for our threshold of meeting that statistical significance of 0.01, and actually our p-value is 0.019. In addition, we felt it was important to provide these data in a way that clinicians could understand. So we also used the win ratio as another way to represent this. And the win ratio for that primary endpoint, looking at mortality, hospitalizations for heart failure and 6-minute walk, that was 1.10, or 10% more wins with FCM, with 99% confidence intervals just crossing the line of unity. So really putting this all together, FCM was shown to be safe, including with these repeat dosings. We saw modest treatment benefits, but overall not meeting the pre-specified level of statistical significance.
So, what will be the next steps? Will you kind of build upon this in a Bayesian type fashion, add some more patients? Will the FDA let you do that? Where do you go from here?
Yeah, really good question. So we're fortunate that we actually partnered with other global leaders from some of the prior trials, including the AFFIRM AHF, as well as the CONFIRM trial. And then we actually pooled those data. So we simultaneously will be presenting data at the ESC with FCM across multiple trials, individual patient level data. So that really gives us a full message. And what we see in that pre-specified analysis is a 14% reduction in a composite endpoint of cardiovascular death and total cardiovascular hospitalizations over that 12-month period, and then a numerical 13% reduction in an endpoint of CV death and total heart failure hospitalizations. That didn't meet a pre-specified p-value of 0.05. But I think putting all the data together now, a number of trials, including actually with other IV iron formulations with the Ironman trial as well, showing us that giving IV iron is safe and that there are potential benefits around clinical outcomes, building upon what we already know about exercise capacity, patients feeling and functioning better. So I think the important message is around safety and adding another tool in our toolkit for patients living with heart failure with reduced ejection fraction if they have iron deficiency.
Rob, thanks for sharing. Thanks for a crisp summary. I like you got it in there in 3 minutes. That's what I always like. Look forward to seeing you over at ESC, and thanks for joining us today.
Thanks so much. Look forward to seeing you all there.
Thanks.